I'm Adrienne Cullen. I'm originally from Ireland, and I was treated at the University Medical Centre in Utrecht in 2010, 2011. To this day, I'm not absolutely clear. Something went very badly wrong, but there has as yet been no investigation. I was treated in 2011 and a sample of my tissue was sent to the laboratory. I didn't know that it had been sent to the laboratory because the sample was taken while I was under general anaesthetic. At the time, the hospital was going through the transition between paper files and electronic patient files, and we think that this might have been the cause of the problem, because it was 2 years before my doctor discovered the laboratory test. It came back 2 years later that I probably had cancer, and nobody knew about it. And in all that time, the cancer was growing inside me. What happened at the UMC Utrecht is still not crystal clear right to this day, even though it's 7 years later, more than 7 years later. I went to the hospital for treatment. A sample of tissue was taken and sent to the laboratory. But the results didn't come back to my doctor, and he didn't see them for 2 years. He didn't remember that he had taken the sample because it was incidental to what he was doing, the procedure that he was doing that day. And I didn't know because I was under general anaesthetic at the time, so I wasn't expecting to hear results back from the laboratory. So when the results were accidentally discovered in 2013, they showed that I had a suspected adenocarcinoma of the cervix. In other words, for at least 2 years, I had a tumour growing inside me, and nobody knew, and I wasn't told the results. My doctor was devastated and responded very kindly and did everything he could. But the response of the hospital was atrocious. They treated it with total silence. Nobody from the hospital had anything to say about what had happened at all. Each day when myself and my husband Peter were going back in there to try to get treatment or to try to see what was best to do next, we expected somebody to come to us and say, "Hey, we heard what happened to you in our hospital, and we'd just like to say how sorry we are, and we'd just like to reassure you both that we're doing everything in our power to find out what happened." Apart from my doctor, who had to stop being my doctor at that point because he wasn't an oncologist, nobody was interested in talking about it. No support was provided. We didn't realise it, but nobody was investigating what had happened. Nobody had any idea what had gone wrong. Nobody provided any support for the patient. Nobody provided any insight into us to help us in any direction whatsoever. No report was being written or carried out. The health inspectorate was not informed that anything had happened. In fact, there was no record at all anywhere that anything had happened to Adrienne Cullen at UMC Utrecht. It's something that's often misunderstood, I think, by people in the general community. We think that our doctors are the hospital and are part of the board and the administration of the hospital. But the truth of it is, even very senior professors and very qualified consultants, they're not part of the hospital administration. They have no influence on the board, and they are often treated with the same lack of respect that patients are treated with, especially when something goes wrong. We didn't know what to do at first when this happened, and we realised after a few weeks of waiting to be approached by somebody from the hospital and waiting for an offer of help, we realised this is not going to happen. So we went to a lawyer, and we found more compassion at the lawyer's office than we did at the health institution. Well, unfortunately, we were driven to taking legal action because we were getting no support whatsoever from the hospital. Taking a legal case against the hospital is not an easy matter, and it's very stressful for somebody in the normal course of events, and when you're sick, it's doubly stressful. We discovered very quickly that the hospital shut down completely once we took a legal action, and all recourse to getting the sort of support that you would expect from a health institution disappeared. We found that now the line of communication that this patient had with her hospital was to my lawyer. The lawyer spoke to the loss adjuster appointed by the hospital. The loss adjuster spoke to the hospital's legal department. The legal department spoke to their insurance company, and we guess the insurance company probably had some communication with the board. Then, when the hospital wanted to communicate back to us, it went through the insurance company, the legal department, the loss adjuster, back to my lawyer, and back to me. And that is not an appropriate way ever for a hospital to communicate with a patient. The first thing that we wanted when we were approaching the hospital after the damage, the most important thing was an explanation of what had gone wrong and an apology, an acknowledgement that something had happened at their hospital, and we didn't get that. We then began to think about, in practical terms, about what we needed. And I think, like any person who's seriously ill, starts to think, am I still going to be able to earn my income? How is this going to affect our daily lives? What impact is this going to have on our financial resources? We had financial plans. We wanted to buy a house. Where do we go from here? So we started to think that the hospital is morally and legally responsible to undo the damage that their mistake had caused to me and to us. We're a couple. It affects Peter as well. So we pursued them legally. We went to a lawyer and we took a legal action against the hospital. And we were told by our lawyer that the highest amount of compensation ever paid in the Netherlands was back in the 1990s, when a man who had haemophilia was given contaminated blood in a hospital and later developed AIDS and died. And he was awarded, at the time, it was in guilders, but it was the equivalent of about 130,000 euros. And we were told that no more than that had ever been paid in the 20 years since. And we were horrified, but we were also very surprised, because we were saying, but why are damaged patients treated this way by the hospital? And why don't the courts intervene and say, no, more compensation is required by patients to put their lives back together when something like this happens? And unfortunately, the cases almost never go to court. It's very, very rare. And the legal system itself is all weighted in favour of the hospital side. They are the ones who have the in-house high-powered lawyers, very experienced. They are the ones who have the weight of the insurance company and the threat of the insurance company behind them. And they are the ones who employ the loss adjuster, whose job it is to decide how much money any patient ever gets. And against that, no patient really has much of a chance. It took from 2013 to the end of 2015, so about 2.5 years it took for us to finally get a settlement agreement with the hospital. And that was one of the most stressful episodes that I have ever experienced in my life. While on the one hand I was being told by my lawyer that the chief executive of UMC Utrecht, Margriet Schneider, was very concerned at the effect that this legal process must be having on my health. I was quite sick at the time. We were also, at the same time, and even in the same emails, being told that there would be a gagging clause in our settlement agreement with the hospital that would forbid us from speaking to the press about what had happened to me in the hospital, about the treatment that I had received, about the consequences of it. And we were forbidden to talk to anybody about how the settlement agreement was reached. In other words, we were forbidden to talk about the fact that there was a gagging clause in the settlement agreement. And that really tore us asunder in a way, because I felt I was very close to the end at the time because I was very ill. And I really did not want to die before a settlement was reached with the hospital, because once a patient dies in the Netherlands, their claim for compensation dies with them. And I didn't want to leave my husband in a financial situation that was not optimal. But we also could not bring ourselves to sign a clause that says that we had no right to speak about what had happened to me in a hospital. And we couldn't do it. So I think it was the 5th of November on 2015 we received the first gagging clause. It was in Dutch and our lawyer translated it for us. And we said no. We said absolutely not. And then there was silence from UMC Utrecht. And then eventually they came back to us. And there was a different form of wording. But it didn't really substantially change the issue that we weren't allowed to speak about what had happened. So again, we said absolutely not. Now, it sounds very easy in retrospect that you say absolutely not, never. But believe me, it wasn't easy. And there were times when I said, let's just sign the darn thing. I don't care. I just want you to be okay. But we couldn't do it. It's wrong. It is absolutely wrong ever to sign that. And the responsibility should never be on the patient to decide whether to sign it or not. The responsibility is on the hospital and on the hospital lawyers to never present such a clause to a patient. It was very important in our case to go public with what had happened, because when you have the strength of public opinion behind you, the only thing that hospital leaderships seem to respond to is being shamed in public. If they feel that their hospital's reputation is being damaged, it concentrates their mind and they will respond differently. It's not possible for every patient to do that because sometimes you're just too sick to. When we finally reached a legal settlement with the hospital, it was with the help of publicity. We had spoken to NRC and we had spoken to other media. As a result of that, for the very first time, UMC Utrecht spoke publicly, and they issued a press statement in which they publicly acknowledged that they had failed me in what had happened originally, and that they had failed me in the way that they handled the aftermath of the mistake. It was very good to hear them making this public statement, but we could not understand why they were saying all this in a press release and not contacting us, the patients, to say, we failed you and we're sorry. So I believe that it looked as though their attitude changed, but in actual fact, I think that they have still a long, steep learning curve ahead of them. I think that the hospital behaved the way it did, and I know that they're not the only hospital who behaves in this way, for a number of reasons, and one of them is the culture of the hospital system. It's not specific to the Netherlands. You hear similar stories in other European countries, in the UK, in Ireland, you hear it in general. It's a very traditional discipline, medicine. And often the people who are at the head of organizations are very different people to the people who are at the front line of helping patients, the doctors and the nurses, the vast majority of whom are kind, compassionate, and well-meaning people. But hospitals are organizations, and they're institutions, and they are deeply hierarchical. And the people at the top live and operate as though they are in a corporate world. And they have corporate lawyers, and they have company cars, and they have the look and feel of big business people, and they behave accordingly. And I think at their worst, and I think that UMC Utrecht is among the worst, they don't have the humility that the medical profession should be defined by. And they are very far removed from the patients that they are treating and the way in which they should treat the patients. And I think that it is very necessary for us now that we start to challenge the culture that has been allowed to develop in our healthcare institutions and to try to bring a more compassionate and more competent type of institution that is based not on heavy top-down hierarchical systems, but starts with the patient at the center and looks at the patient's needs and facilitates and enables the people who are working with the patient to fulfill those needs and to filter that up through the organization to the top. And I think that that change has to happen from the bottom up, because the change is not going to happen from the top down, because the top has been too comfortable where they are. I do think that the role played by the Health Inspectorate should be more hands-on, and as a regulatory body, they should have more of an oversight role or more of a watchdog role. And I think that when it comes to things like the gagging clauses in contracts, I know that the previous Health Minister, Edith Skippers, was unequivocal in her condemnation of using gagging clauses to gag patients from speaking out about their own stories. I think she should have gone further and made them illegal. I think that the current health administration, the current health minister, should look at that again, because I am not satisfied that these are not happening. I think that we can't manage without the involvement of politics. And I think that people should communicate this to the politicians that they know, and try to say that this is not what we want. We pay for the health system. We're the patients, we're the taxpayers. Those hospitals are ours. They don't belong to the board of the hospital. And we need the help of politics, and we need the help of the hospitals to make that change. Only recently, after 5 years of asking for this to be done, has UMC Utrecht agreed that they will carry out a root cause analysis, a SIRE investigation into what happened in my case. This is a huge relief to me, but I'm very conscious that having allowed all of this time to pass, where they refused and refused and refused, not only did they refuse me, but they refused the requests of the head of their own gynecology division, who asked on my behalf repeatedly that they carry out this investigation. And they have now agreed that they were wrong not to do so, and they're going to do so, and that investigation is underway. And I hope that it won't be a whitewash. I put my trust in them, and that they will find at least some answers that will help me and Peter come to terms with what happened. I suppose the scary thing is that this could all happen to somebody else, right now, tomorrow, anytime soon. It is still happening because, unfortunately, since I started to speak out about my story, I have received emails WhatsApps, letters, postcards, with people telling similar stories, patients who don't know how to fight back, patients who also feel that they've been squeezed between the hospital and the lawyers, patients who feel that they have taken complaints and nobody ever replies to their letters of complaint. I've heard of people asking for their medical files and they never received a response. It's all too easy for the patient to be the small person still, and nobody is fighting on our side to try to make sure that we are empowered to get the information that we're entitled to have the questions that we ask answered, and to have the support needed when something goes wrong. When hospitals fail, patients are damaged once. If this isn't handled properly for them, they're damaged twice.